LASIK is a procedure which simply reshapes the very front part of the eye, the cornea, and it allows people to see without their glasses or contacts. And there are different laser types which can do this. However, in general, that's LASIK. But there's a lot of misconceptions. It's not uncommon for patients to come in saying, "Can you treat astigmatism?" I was told that astigmatism can't be treated. And the answer is yes, absolutely. We can treat nearsightedness, we can treat astigmatism, we can even treat farsightedness. Nearsightedness is where people can see up close but they can't see far away. Astigmatism is where their cornea is kind of misshapen, almost like a football versus a baseball. And as long as the cornea is healthy, as long as it's astigmatism but it's a healthy cornea, yes, we can treat that cornea and reduce the astigmatism and get you out of your glasses and contacts with LASIK. So that's a very common misconception. Another common misconception is, and patients will often ask, how long will this last? And I always ask them the same question. If I were to give you a prescription for glasses today, do you think your glass prescription would be the same in 10 years? And they invariably shake their head no. No, I would expect my glasses to need changing. And then I would ask them, is it because your glasses have changed? And they would say, no, of course not. My glasses are the exact same prescription as they were 10 years earlier. What's changed is my eye. And I said, and that is for the most part the same with LASIK. Nearsighted LASIK, which is the predominant reason why people have LASIK, for the most part, in general, does not wear off. It removes tissue and the cornea doesn't necessarily put that tissue back. I'm not saying that it can't happen, but it's not common. So if the eye changes underneath the LASIK or underneath or behind the glasses or contacts, then yes, then your eye will change. And I tell people LASIK doesn't set the eye in stone. It doesn't stop the eye from aging. Whatever genetic factors and genetic predispositions and environmental factors and predispositions, however that impacts what your eyes are going to do over time, LASIK is not going to stop that from happening, but LASIK will reset your eye as opposed to a pair of glasses or contacts which do not reset the eye and only artificially correct the vision when you're wearing that prosthetic device. Another very common misconception is LASIK is expensive. That is true in some respects, but what's not true is that it's expensive relative to other forms of vision correction. Glasses can often cost $500 or $1,000 a year. You do that and you add that up, and that money adds up over time. Contact lenses, same thing. If you add up the cost of your contact lenses and the cost of your solutions and all of these other things, you'll find that very quickly the cost of these other ways of correcting vision quickly catch up to LASIK. LASIK may cost more up front, but it saves you the trouble of having to spend your money on those other things over time. So the idea that LASIK is more expensive than other ways of correcting vision is not usually true. Rather than talk about a misconception about LASIK, I'm going to talk about a misconception of one of the most common ways that people correct their vision, and that's contact lenses. And the most common misconception about contact lenses are that they're safe, that there's no risk associated with them. And that is absolutely not true. In fact, it's been shown that over one's lifetime of wearing contacts, the risk of wearing those contact lenses in terms of sight-threatening problems is higher than the risk of having LASIK. So contact lenses, when compared to LASIK, in many respects, is less safe. And if patients say, oh, I'm concerned about having LASIK, I ask them, are you concerned about wearing contacts? And they say, no, I wear them all the time. And then I explain that to them. And I'll also tell them that I've done countless corneal transplants on patients who developed sight-threatening corneal ulcers from their contact lenses. I can't remember how many times. Many. And I can easily remember the number of times that I've performed a corneal transplant on someone who had previous LASIK, because the answer to that is 0.